Welcome to the Quantum Health Webinar. My name is Cyril Bourke and it's my pleasure to present the NES Health Introduction to Animal Therapy. So welcome to you. Now, NES Health has led the world in the field of human body field scanning and applied informational therapy for more than a decade now. And that groundbreaking research has been applied to the animal kingdom. We can truly say that this technology has been tried and tested on humans and is now ready for clinical use on horses, dogs and cats. Over the next few slides, we're going to review the NES animal system and compare it with the current human system. So we'll be talking, as you might say, the NES language of integrators and drivers, energetic rejuvenators, etc. For those unfamiliar with NES therapy, I recommend looking at the research and work of Harry Massey and Peter Fraser when they combine their science to create the therapy of NES, and the details of that are found in Decoding the Human Body Field and Energy and Information in Nature. Two excellent publications worth finding for those who haven't got a background in NES and would like to know more. Now the animal screens for horse, cat and dog. The difference between the NES Provision for humans and the animal Provision system. So both systems start out opening up with the energetic rejuvenators, which are composites of information from brain holograms and integrators and other information patterns. Then we have access to information with polarity and BFA, drivers and integrators. But in the animal area, we don't have access to the terrains and the stars. So the ETs and the ESs are not visible on the animal system. In the mind area, we have the mind and the look within, and we see representations of the mind responses as related to ERs and integrators. But we don't see the areas of life purpose, the creative cycle, we don't see transformations, and we don't see legacy brain holograms. That information is still represented through the ERs and the mind area alone. We have the nutritional information and we have the environmental information. And we'll be hearing from Dr. Rob Willis later about some amazing things that's happened when he's worked directly with the environmental information, looking at conditions with animals. Now the animal wellness system, the program still follows the same education online and in workshops, the same as the human process. So all the background information is just the same for ERs, working through each of the areas all the way through to the holograms. And we're making a lot more use of tablets and mobile equipment with the animal system. Here you can see a tablet in the hands of a practitioner here, happens to be in an arena. We've just done a scan of an animal. As you can see, straight away somebody's using a tablet that's very easy to handle, walking straight up to the animal and being able to scan there and then. So the touch screens are really making a difference now with people's mobility, treating in the field, in arenas, in horse boxes, making things really fast and accurate and being able to present it directly to the clients there and then. Here's that screen or another screen in detail. So this is the ERs. We're actually seeing the pathways, the meridian or energetic integrator information being highlighted through the body. Now this screen has lots of the ERs, in fact all of the ERs represented here. To reduce that, we do the same as the human system by simply highlighting either the orange or purple, and only the orange and purple would then be seen. At the same time, if we were to click on any of the ERs individually, it would highlight one of those lines that goes through the animal, so you can see a treatment pathway. Here's a look at the energetic drivers. We still have 16 drivers. The embryonic stages are identical, but now they're laid onto the animal in question. In this case, we've used a dog. Here is the actual page from the scan, and here we've got it represented on a horse. Again, you've got all your information down the side, as in the right hand side, related to help screens. In this case, I haven't shown that on the screen save, but you can see how things are identified on the screen, and you'd be able to work with that. Now, there's been a lot of information about horse racing and people really finding it interesting. Now, in the race for wellness, the new animal wellness system is an odds-on favourite. We've been seeing lots of interest from people racing horses and looking for performance animals, and this is somewhere there people are really enjoying seeing changes. Here we have a group of practitioners that have just gone through the animal training. This was in Albury in New South Wales. As you can see, they were all well wrapped up. The temperatures dropped to -3 degrees centigrade, but the whole team are out there, all 12 practitioners, really enjoying the work and making use of the arena at the Disabled Riding Centre. So it was great to have an active group of practitioners, which included doctors, vets, massage therapists, even supply owners of pet shops, all getting involved in learning the system and being able to apply it. Now, this is Dr. Rob Willis. Now, we've got a recorded conversation with Rob, so let's play that. Hello, Rob. Welcome. Thank you for joining us today, and we look forward to hearing about the clients you've been treating.
Yeah, hi, Cyril. It's Dr. Rob Willis speaking here from Wangaratta. I've been doing a few more scans this week, and yeah, certainly the results are continuing to come in, which is really exciting. And I think for every animal that's coming to me at the moment, the owners or the clients are then bringing in another animal or arranging another horse to be seen or another dog when they weren't expecting to, or sending their friends or other family members and their animals in. So yeah, certainly been going really, really well, and especially on the back of doing the animal training course there a couple of weekends ago. It's nice to have got a lot of feedback from people that are also using it and just hear their stories too. But yeah, a couple of really good ones in the last couple of weeks I've done. One's a little dog I saw yesterday. It's a much older dog, a 16-year-old dog, and it's actually been having a lot of breathing problems and waking up having fits, that what the owner describes as fits in the night. And yeah, a lot of respiratory noise and nasal sounds and lung sounds, and the vets have blood tested it, and being 16, they've put it on a bunch of medications as was needed, and still not going very well. She was very worried and thought this little dog might need to be put down sometime late this week or early next week. So, and that was kind of the information she'd been given as well. And anyway, so we did a scan, and it was a really good little dog, and showed up quite a few things. The lung driver was a complete blockage, complete red, and we also had a complete blockage on the kidney driver as well, which was interesting. And just the ERs pinpointed like lungs and tonsils, paranasal sinuses, esophagus came up, which was interesting too. But the real little pearl of wisdom in the scan for this dog was when I went to the toxin screen. It showed up with smoke at a red level distortion up at 100%. So I asked this owner, I queried her about smoke in the little dog's environment, because it's only been going for a couple of months. And I said, has anything changed at home? Any smoke, or, someone smoking cigarettes near the dog that wasn't previously, that sort of thing. And she said to me, no, not like that, but just with the winter, they've got an old house and an old fireplace. It's an open fireplace. And she said it does put out a lot of smoke into the house. So, and been going on about the same amount of time as this little dog's been sick. So, something like that, in a 16-year-old dog that I think the dog might have been 2 or 2.5 kilos in size. A lung capacity, if you close your fist, each lung might have a capacity of sort of half your fist size sort of thing, if that. So a little dog at age 16, where the lungs and everything are deteriorating anyway, is just not going to handle that much smoke. And even in the little day out, they travelled a couple of hours to see me, even in that day of being out in fresh air and coming down to me and giving it the lung driver, kidney driver, and some BFA. The owner was very surprised at suddenly how well the little dog looked. So that would be another example of something where it lined up really well with the blood test results that the dog had at the vet, but also, yeah, definitely There's no other way anyone would have ever guessed it was due to basically smoke inhalation in the house. And interestingly enough as well, she had actually bought a humidifier. She thought maybe if she put a humidifier in the house that would actually help the dog, not realising it was the smoke causing it. So when an animal inhales smoke, the effects are basically caused by creating moisture in the lungs. And so a humidifier is actually going to make that worse. And she did say since the humidifier gone in, the dog's got worse rather than better. So, they're just awesome stories and things that would not have been possible at all without having something like Ness able to identify those sorts of exposures. So, yeah, that one was just a good one because I don't do a lot in the toxin fields, but that one just knocked it on the head in one go. So, yeah, I was wrapped, the owner's wrapped, and I've had an email from her today, so about 24 hours after treatment already, to say how much better the dog is and had the first decent night's sleep last night. So, yeah, couldn't be happier with the system myself.
Yeah, no, look, that's fantastic because it's an area that people often don't spend too much time on, and unless it's really obvious, and you've been able to link it directly, knowing what's happening with the fluids on the lung. So she really needed a dehumidifier and maybe an air ionizer to drop the particles of smoke out of the air. Yeah, that's fantastic. What? You mentioned there was another one as well. Oh yes, sorry, the cushion dog, Lynx. Maybe if you want to have a talk about that, because you were able to actually revisit the diagnosis, and with what you saw in the nest, you were able to refine as to where it was, and now you've proved it with testing, I believe. Is that right? Is that what you did?
So Link was a little Jack Russell, a little terrier cross that came and saw us at the animal training course in Albury, and he was a really good one actually, because he had just come back from the university where he had seen some vets up there, and he had came back diagnosed with spinal stroke, but it hadn't been diagnosed as such. It was just kind of the best thing they could kind of find given the given his symptoms. They didn't do an MRI, which is really, as far as I know, the main thing we use to diagnose them. So, yeah, I guess the diagnosis in some ways came back. He had a CT scan, he had some X-rays, he had a couple other things, blood tests from memory, but basically came back with, we think, a spinal stroke. So since he had returned home to the owners, he had got progressively worse. He had been unwell for quite a long time. And, we probably had a day down there, as anyone would know from that animal training course. It was about -3 degrees and getting colder, and the heaters weren't working really well. So everyone was freezing. And this little dog, I just noticed during the day, he had been panting a lot, which is really unusual for a little dog to be panting in those cold conditions. So he was used as the demonstration. And once Cyril scanned him and the results came up, I was having a look, and one of the things that really interested me off the back of the scan was the adrenal glands were pinpointed from the provision in the ER section, and we do know there is a hormonal disease with dogs of the adrenal glands. There's two. You can have underactive adrenal glands and you can have overactive adrenal glands. And just when Provet pinpointed the adrenal glands, I thought that was quite interesting. And the muscle driver coming up as well, I thought was fairly interesting, because those conditions we both see, whether it be the underactive adrenal glands, which is Addison's disease, or the overactive ones called Cushing's disease, both of them result in muscle weakness and extensive muscle problems. So when I saw the adrenal glands pop up and the muscle driver come up with a full distortion, I thought there was a real possibility that this little dog may have had either Addison's or Cushing's, and particularly with the panting for the day, potentially it was a Cushing's dog. And so we ended up recommending to that owner, off the back of putting a few things together, and particularly the Nest scan, getting my brain ticking, that perhaps this would be worth asking her local vet to test for. And she did. She went and asked the vets, and the vets were good enough to assist us with that investigation. And lo and behold, within about 48 hours, we had a diagnosis came back of Cushing's disease, which was just fantastic, because it's not a brilliant diagnosis in itself, but at least finally we had the correct diagnosis for this this little dog. And it is a very difficult disease to treat, even though we have got the right diagnosis, but certainly with the help of NES to identify it, and also with the info-ceutical regimes we can do, it'll be a very interesting little dog to treat, and just see if we can help this dog out a lot, because Cushing's, it's a difficult disease to treat, but it's also a very expensive disease to treat. So if we can assist the owner with his treatment, hopefully we can get a really good result and keep her costs down. So yeah, that was another one where you could link in the work that the guys had done at the uni with what the dog was showing in with the scan, and go, well, hang on, this is all pointing towards something else other than what he's being diagnosed with. So yeah, so that was really pleasing when that positive result came back. Human practitioners that are currently using NES, I'd really encourage them to look at obtaining the animal system. The animals certainly respond really well to both MyHealth and info-ceuticals. They seem to respond quite quickly. The onuses notice results quite quickly. And look, in animals where a lot of the time it's really hard even for vets to work out what's going on, equipment like this is just priceless, where it will pinpoint things so accurately for you. And even some of my colleagues, my veterinary colleagues, I've shown when I've scanned animals, they're blown away by what it will pick up, even if they've not previously looked into energetic medicine or anything like that. So I think it's just a great tool to have as a practitioner. If you're already practicing as a human NES practitioner, why not try the animal system as well, because there's so much overlap energetically between your human patients and their animals. And I'm sure you'll be getting asked if you can do animals too.
Now, one of the horses that Rob's treating went through phenomenal changes within the first few weeks of treatment. And here is an example. This is the third race after treatment, and this is the horse that Rob was treating. And this is the distance from the rest of the racing horses. So there's over 3 full lengths of a horse difference between the rest of the group. This shows a phenomenal improvement for this animal that hadn't been placed in almost 16 months. So this is the type of thing that can go on with animals when they're treated with this type of technology. Now, planning treatment. In the same way you would record a human health history, you'll need to record the animal's treatment history. Previous accidents, shock situations, surgeries, relationship changes, the supplements and prescriptions the animal's being provided. All of these things have an impact in the same way as it does on a human. So we have to record that history. Often you'll find things that you may not have thought were happening, things like animals being on antidepressants, or all sorts of things that can have a big influence on the animal itself. Now, in the same way, a human partner or close family member can be a contributing factor or influence on the health of another. The same is found between pets and their owners. For example, a young child can suffer from anxiety and emotional stress by sensing the parent's own emotional state. Animals often act in the same manner. The animals tend to place the human in the alpha or leader role. So when there's emotional states occurring with that alpha or leader, often the animal mirror that situation. So a stressed owner can provide a stressed dog. Now here's another example. If an owner is frightened of thunderstorms, then the animal will often react in the same fear. They may both benefit from NES therapy to support recovery in the situation, using NES provision for both the human and the animal. Treating them both will help both of them. Now, general hygiene considerations. It's recommended to wash your hands between clients and between visiting properties. This might mean cleaning your boots, making sure things are not being transferred, making sure your overalls or clothes you're wearing aren't carrying mud from the previous property. And this is obviously a good practice to minimise disease transfer. It is recommended to wipe the electrodes, the metal bars on the NES MyHealth device, give them a good antiseptic wipe. Also, obviously cleaning your hands, your shoes, making sure that there's no transfer of any contaminants from one property to another if you're travelling between properties. Now, there are some extremes to this where things like equine flu and Hendra can actually be very hazardous for animals and in certain cases transmit to humans. And it's up to every practitioner to be aware of what's happening in the global and their national regions. Often disaster teams and people of this nature will come in and control the movement of traffic and things like this, particularly with Hendra, which in Australia can kill humans as well. So it's worth knowing what are the requirements locally and being aware of what's happening in your area for animal conditions. Now, the skin and coat conditions. Skin and coat, just like a human, can show a lot of different health aspects. Now, often parasitic diseases in animals are seen through the coat. Things like ringworm, fleas, scabies mites, other bacterial funguses, things of this nature. Now, as a general recommendation for animals, if they're suffering distinct skin conditions, then it's worth having the owner confirm whether they've had any veterinary advice, because there's lots of conditions that are contagious and very, very easy to handle through simple surface preparations. And that's most commonly the first line of treatment for a client prior to coming to NES. Diseases like ringworm and mites are highly contagious, be easily passed between patients via contact with practitioners' hands and the MyHealth device. Now, here's some pictures of common conditions. Can you identify them? Let's have a look in a bit more detail. This example is mange. Mange is a broad term that describes skin disease. Scabies, a form of mange, is caused by microscopic mites that lay eggs under the skin. Scabies mites are round and they are so tiny that they are not visible to the naked eye. These types of mites tend to prefer areas of the dog with no hair or very little hair. In the beginning, mange often results in severe skin inflammation, which can trigger intense itching and uneven hair loss. Scratching may occur as a secondary infection, secondary skin infections, and it's very easily transmitted from animal to animal. Here's another condition you might come across. It's called ringworm. Despite the name, it's not a worm. It's actually a fungal infection, and it can go into the eyes of the animal. It can go into all areas of the hide and hair. Very uncomfortable for the animal, very easily transmittable, and very easily treated. So these are areas where most clients will probably be seeing a veterinary doctor first to deal with those areas in the normal way. And it's important to know if that has been done or not. Fleas are another common thing that you'll start to see when looking at animals. Now, only about 5% of flea populations actually live on the pet. So 95% of the flea eggs and larvae and pupa, they're all living in the environment, shall we say, in the bedding or in the carpets or where the animal tends to rest or spend its time, its bed. So treating the animal itself is only part of the story. Obviously, making sure that the bed and what comes in contact with the animal are also treated or dealt with. Again, this is something that's very commonly treated with medications and surface treatments. Now, the NES scanning system provides biofield information that indicate to the practitioner the underlying distortions that NES Health and MyHealth info-ceuticals are specifically designed to interact with. And that's important to recognise because the scan is not designed to diagnose any disease or identify any pathologies, nor is it designed to identify other forms of treatment such as alternative homeopathies and other types of treatment. It is specifically designed to identify which types of application of MyHealth device and specifically what types of NES info-ceuticals. So the scan is solely for that purpose. Now, some ideas about animal handling, because unless you own a pet or are familiar with a variety of animals, this may be a new entry into handling animals. And there are some safety items to be aware of. The main one with dogs, obviously, is being bitten. And if an animal's coming to you, it may be because it's distressed or nervous, and it may have behavioural issues. The other less concerning but still unpleasant is scratching from dogs, and really the animal should be restrained by the owner if required. Muzzling of an aggressive animal or a dangerous animal is perfectly acceptable and recommended, but practitioners should not try and fit the muzzle themselves. The owner is responsible for putting that on, and often vets are bitten when they try to apply a muzzle to an animal, so make it the owner's responsibility. Now, with a dog that you're not familiar with, remembering some of the behaviours of dogs, try not to make extended eye contact, and do not sit on the floor with the animal if you're unfamiliar with them. The dog will be looking to maintain its authority, and you only maintain it by being above it. Become familiar with the warning signs. Stiff, rigid body of an animal, a not relaxed state, growling and other vocalizations, lip curling and showing teeth. These are all obvious distress signs from the dog. In reality, Nest treatment is pain-free, it's non-intrusive, and it actually feels really good. So once the dog sees and understands what you're doing, they normally become very cooperative, and it means follow-up treatments are much easier. The dog doesn't see you as someone who's going to harm them, and they enjoy the therapy. So very quickly you can change the emotional state of an animal to make it more cooperative for therapy. Now, cats, in a very similar way to dogs, end up scratching and biting if they are distressed or feel like they're cornered or being put through something they're not enjoying. There's various ways that people can suppress a dog's and cat's behaviour. Sometimes they're wrapped up in a towel and things to stop them hurting each other. You shouldn't find yourself in that situation if you present a calm, deliberate process. Now, sometimes with the fur, you'll find it's difficult to scan a cat, and often you'll put the device underneath the armpit or the belly to get a good contact with the animal. Now, you may want to set the My Health device on broadcasts, settings relative to the cat's behaviour. So maybe ESR or chill, something that might calm the animal down if it does appear to be stressed. And you could have that running while you're discussing the scan details with the client. Now, another warning with the cats, one of their signs is if you look at their eyes, the dilated pupils or hair standing on end down the back, the ears pinned back. Cats may often growl or pant. All of these are stress signs, so be aware of what you're seeing with them. Now, horses are obviously large animals. Kicking and striking, biting, these are all things that are potential risks for the practitioner. So be aware of the horses are able to kick at about 360 degrees. They can kick all round their body. So there is no real safe area. In fact, often you're better off being right up against the animal where you're not at the hoof end when they strike out. Keeping contact with the animal, having a hand on the animal often reassures them and takes any stress that they may have and reduces it. Also, maintaining contact with the animal allows you to understand if they are moving, and you sense that activity. But remember, a horse will kick faster than you'll see it coming. So go slowly, be sure and speak confidently around the animal, and no rapid movements or outbursts. And make sure that there's a competent handler working with you. If this is the owner, then they need to be concentrating on what you're doing, normally maintaining the same side as you on the animal. Please don't allow them to be distracted on phones or talking with other people. They need to concentrate on supporting you, making sure the animal maintains a stable position so you can work with them. Look out for signs such as fast tail switching or stamping of feet. Keep an eye on the ears and looking at the animal moving around. Normally very quickly when they feel the My Health or treatment, they'll start yawning, you'll see the head lowering, and you'll see the animal start to relax. And that's a great starting point for treatment for horses. Here's some happy faces. You can see these, not threatening and thoroughly enjoying their therapy. Now, part of enjoying therapy is the practitioner. Now, the practitioner yourself have to relax. When approaching an animal, they perceive your stress, they sense it, and they innately consider that to be a threat, because particularly with horses, they are a prey animal. So they're looking to see who's stressed around them, because that often indicates they're going to be attacked. So you must remain relaxed. Now here's a bull. Now the animal system isn't specifically set for cattle and bull at the moment, but there's a wonderful video referred to as Calming a Bull with a My Health, which for those of you that may have concerns about how rapidly you can calm an animal down, I recommend looking at this YouTube. Now that was a bull and you'll see his behaviour change dramatically within a minute of coming in contact with a practitioner holding a My Health device. And it's designed to give you some confidence in how fast an animal will calm down when there is no threat provided and they sense a calming event and the device itself. So I recommend you look for that on YouTube, and it'll give you hopefully confidence in the use of your device to calm animals. Now when you're going to do a scan, you need to calibrate the electrodes, particularly if you've travelled a long way or even done air flight, or if you're regularly treating different types of animal, I would suggest to calibrate the device each day. Now you can do that from your settings area in the bottom right hand side. It's indicated with a wrench. If you press that button, you'll find the calibrate electrodes. Follow the instructions and try to do that at least once a day if you're treating animals. Now, info-ceutical delivery. There are many different ways of providing info-ceuticals, and you have to find the most suitable for the animal you're treating. Sometimes it's in a bowl of water if the animal doesn't share the water. Sometimes it might be with favourite snacks or food. With horses, we've often provided it directly into the mouth using an oral syringe that you can see here. Now, how many drops? Well, the smaller the animal, the smaller number of drops we tend to provide. With a horse, we've been providing up to 2 millilitres a day, and that seems to be a very good amount as far as the info-ceutical will last about 10 days if they're treated once a day, and giving the information time to settle into the field. For dogs and cats, sometimes we might provide less, maybe 3 to 6 info-ceutical drops, but maybe we might provide it in their food twice a day. Depends on what you're treating and how you're working with it.